All right. Hello, everyone. And do you sometimes wonder how to prepare for your doctor's appointment? Well, today I'm going to be sharing tips to make sure you get the most out of every appointment so that you're confident about your health. So, welcome. This is Connecting the Dots with Dr. Ashaye, a great place to be if you desire to take charge of your health so you can live fully and enjoy doing what you love. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugar Land, Texas. And I am so excited you're here. This is the place to be if you're seeking a more convenient and proactive approach to your healthcare. So come join us. You can enroll on our website, www.intouchprimarycare.com. And we're going to get right in. So remember, you can always listen to this episode and all our other episodes on the InTouch Primary Care YouTube channel. Leave comments, subscribe, and share. So share with someone that might need it. You never know, it could make a huge difference for them. Okay, so today we're going to be talking about how to make the most of your doctor's appointments. And as you're preparing to go to your doctor's appointments, I want to first talk about some of the questions I get often. So the first thing I'll say, even before we get to the questions, is make sure when you go to your doctor's appointments, if you are taking medications, especially for your first visit, make sure you take all your medications, your vitamins, your supplements, whatever it is you're taking, bring it with you to your first appointment. And then if there have been changes made to your medications, make sure you let all your doctors know. So I've had many patients that this has happened to, where they're taking two of the same medication by the time that I see them. So they were seeing other doctors, they came to me, I'm going through their medication list, and they're taking two of the same medication, they just have different names. So for example, they're taking pantoprazole and omeprazole, right? And those medications are for the same condition. They didn't realize it was the same thing, and so they're overdosing on a medication and not knowing it. So it's really important that you keep track of your medications, that you know exactly what you're taking, and that you bring it with you to your doctor's appointment. The easiest thing is, if you're not sure, is just bring them in. We'll take a look at it. We'll help you sort it out. But make sure if you are taking medications, let's bring them in. Okay, so I wanted to get that out of the way. And then let me get to some questions as well. So one question I've gotten is, should I take my medication before I go to my doctor's appointment? And the simple answer is yes, except they specifically tell you not to take it. So I've had patients that come in and they think they want me to see their blood pressure in its natural state, so they don't take their medication. Well, that just delays the whole management, because if the blood pressure is high, which most of the time it is, because they didn't take their medication, then guess what? They're going to have to come back again with taking their medication before I can make any changes. So we don't need to see it in natural state. The state is when you are taking your medication. Just come doing what you typically would do. That will give us the best idea of what we need to do next. So by stopping what you typically do, we're having to go back, have you do what you typically would do, and then come back and reassess. So most of the time, except they specifically tell you to hold the medication, just take your medications as usual before coming to your doctor's appointment. Because when you don't do that, a lot of time you're just delaying your care, and you're usually going to have to come back taking your medication before we can make any changes. So it just wastes time and money. So that's the first thing. So if you're not sure, ask your doctor, but most of the time, just keep taking what you were taking when you come in for your appointment. Number two, which kind of ties in, should I fast for blood work, or shall I fast before I come into my doctor's appointment? So a lot of people sometimes will think they shouldn't eat anything in case we're going to do lab work. But it depends. Most lab work actually do not require you to fast to do it. And even when you do your physical, the only test that would be helpful for you to be fasting for is a cholesterol test. And many times we can actually get around that. So if you have a morning appointment, maybe it's the first thing in the morning, and you're pretty sure that your doctor's office has a lab there and they're going to do the blood work right away, yeah, maybe it's worth it for you to fast. But otherwise, if it's going to be a hassle for you to fast, let's say your appointment is at 2 in the afternoon, you're not even sure if they're going to do blood work or not, it may not be worth it, because you're going to spend that whole day hungry. And then at the end of the day, the labs that we're doing did require you to fast. If you're in doubt, always check with your doctor. But generally speaking, most of the time, if it's going to be a hassle, you may not need to fast. And, it depends. But, I personally don't encourage my patients to fast before coming to see me, because I don't want them hungry. I want them happy when they come to me, but also many times they don't need to. So it doesn't save them any time or money. All right. Third question, should I keep my appointments if my symptoms have resolved? So this really depends on the doctor that you've seen. If you are seeing your own primary care doctor and you consistently have one doctor that you see, absolutely let your doctor know that you had the symptoms, this is what happened, and now it's better. Because sometimes they need that information to understand what's going on, big picture. So for example, if it's somebody that consistently gets like a sinus infection, or they consistently have a sore throat, or they've had many different things over time, or even a urinary tract infection, they're getting, them frequently, or vaginal infections, and you are not letting your primary care doctor know, and then you just have one, maybe, and you only tell them once in a while when you have it. Sometimes there are things they can do to prevent these things from happening, but they don't know that it's happening so often. So they're not giving you that option. So when you have one consistent doctor, it really helps, because things like that can often be solved when they're aware of what's going on. Now, if you're seeing many different doctors, this is a lot harder. Or if you're going to many different places for your care, because oftentimes when you go there, it may be a waste of time if you do not have any symptoms, because they're like, so why are you here? We can't fix anything right now. But that's not ideal though, because whatever happened might be something important, but nobody knows about it because you're seeing so many different people. And so nobody can help you connect the dots. So it's really important, ideally, yes, if you no longer have symptoms, ideally, yes, you should still be letting your doctor know about it. And that's why it's so important to have a primary care doctor. But in a scenario that you don't, and you're just going for that one concern, I don't know, it may not be as helpful because your symptoms have resolved. But what I'll say is find a doctor that you could tell, so that they can keep track of things and help make sure that you're fine overall. Okay, so now for tips, so I want to share some tips that can help you make the most of your appointment, but I wanted to get those questions out of the way. So if this is especially if you have conditions that require regular monitoring or treatments, like high blood pressure, diabetes, asthma, heart disease, but this can also be extremely helpful even if you're healthy and you just want to be more diligent about keeping track of your health care. So how do you make the most of your visit? Number one, write down your questions and concerns so that when you get there, you don't forget. So a lot of times people come in, they're like, they made an appointment maybe 2 weeks. Unfortunately, now sometimes it takes months to get in to see the doctor. Not with us. You can get in same day or next day. But if you've seen another doctor and it's taking you months to get in, by the time you get there, you've forgotten almost half of what you came in for. So writing down your questions and your concerns, having a little book where you can keep track of your health questions and concerns can be very helpful, and you can check it off as your questions are answered. So that's number one tip. Number two tip, have your own medical records. So unfortunately, there isn't a great system for people to keep track of the medical records. And I know a lot of people can sign on into portals and get their information there, but oftentimes they don't sign on enough where they remember the password. Many times people come in the office and say, oh yeah, I did this and I have it on my portal. And then they spend the next 5 to 10 minutes trying to get in. to find the information. But if you have a way of writing down these things, the things that are important in your own little notebook, and then printing out things that, the studies that you've done, putting them in a little folder, it can make such a big difference if you're organized about your medical records. Because the thing about it is, a lot of times people spend a lot of money, waste a lot of time repeating tests that have already been done. And I've seen this over and over again. You have a symptom, you forgot that somebody had done an MRI 5 years ago for it, and everything was fine, or it's the exact same thing, and you are having to repeat the MRI now because nobody can find it, or you had a colonoscopy, it's not, you don't remember when it was, and so we're like, okay, well, we don't remember, so we're going to repeat it. Maybe you had it 5 years ago, maybe it's not time yet. There all those things that are that can be avoided. We're repeating tests because people can't find their results. So you can save yourself a lot of time, energy, money by being organized about your own medical records, keeping it yourself in one place and making sure that you have it available so that your doctor can use that information. And we keep your medical records, but a lot of people move around a lot. Unfortunately, people don't stick with the same doctor for long periods as it used to be before. So people's medical records often are not in one place. But if you come to us, that will be different. But I know a lot of people see a lot of different doctors, so wanted to share that. Now, the last thing I wanted to share is ask questions. And this is so important. It's so important that we understand what we're being diagnosed with and how it's being treated. Just taking ownership of our health is really helpful, because when you understand why things are done and what is being treated, it makes a difference. I told that example of that patient that was taking 2 of the same medication. Well, that's because she didn't understand why she was taking it. She didn't realize they were both for acid reflux. So if she had asked, like, hey, I'm taking, she had written it down and she said, oh, I'm already taking this for acid reflux. Shall I be taking both? That makes a difference. But because she didn't know, she was causing harm to her body by overdosing on a medication. So it's so important to ask questions. Don't be shy, ask the questions. Let's make sure that you know what's going on. Take full ownership of your health. So remember, especially if you have chronic health conditions, but even if you don't, there are 3 easy things you can do to start to take charge of your health starting today. Number 1, you can write down your questions. Number 2, you can keep track of your own medical records. And number 3, be sure to ask questions. So by doing those things, you can really improve your health and help your doctor help you. Awesome. So if you are in the Houston area and you are looking for a doctor to help you with your health, one that is proactive about your health care, check us out InTouch Primary Care in Sugar Land. And you can schedule, if you want to get to know us first, you can schedule a one-time detailed evaluation, or you can join our membership practice, which can be very helpful for individuals and business owners. We are having a webinar, an event this Saturday, and I would like to invite anyone in the Houston area. And we're having a event at the West Pearland Library. It's a free lunch and learn, and we're going to be talking about your personal and business health. So if you're a business owner, you're an entrepreneur, or you're an individual and you want to learn more about your personal health, or you want to start a business and you want to hear about business health, join us. It's going to be a wonderful time. West Pearland Library at 12 to 1 p.m. And I look forward to seeing you there. All right, have a great day, and I'll see you next week on Connecting the Dots with Dr. Ashaye at 2:15 p.m.